finished my PEDS rotation as an FNP student, and if you're an NP student and you want some tips, here are some things that I think would be really useful, particularly in PEDS, but in general, especially if you're nervous. Of course, with the controversy of vaccines and such, we know that we need to know that vaccine schedule, particularly in PEDS, but I think that education is one of those things that are very important, and you as an FNP student should get really comfortable with educating your patients on what to expect with vaccines. Things like the baby can be very irritable. They may not want to necessarily eat, but maintain them hydrated. If they can get a mild fever, it should not last over 48 hours the max. And the site of the puncture can be a little bit red for up to 2 weeks. You want to also educate them on reasons to come back. If there's an extremely high fever for over 3 days and there's no explanation, if they seem dehydrated and you can explain what those are, or if you see that there is a significant decline in being able to stay hydrated, and or if they develop a rash that's inexplicable and doesn't clear after a couple of days. Those are the kinds of things that you as an FNP student can absolutely educate and take part of in the care. The thing is, most people come in and they are expecting antibiotics because they feel sick. Not everything requires an antibiotic. So explaining and educating on what would require an antibiotic and what doesn't require an antibiotic and why would also make you feel more comfortable as to what your diagnosis and management would be when you get to that level and that clinical skill. The last thing is, if you are going to prescribe antibiotics, do not rely on just pharmacy to tell them, how long they're supposed to take this antibiotic. Make sure that they know that they need to take the antibiotic as it is prescribed for as long as it is prescribed. Create the full course, finish the full course, so that you don't create other issues by not finishing it or don't continue to get sick. That education piece is very important, because a lot of people feel better and then they stop taking their antibiotics and they get sick again and think that the antibiotic didn't work. So those 3 pieces of education, if you bring them in to your clinical site, will make you feel a lot more competent. It becomes a little bit of a boost, and you can always discuss with your provider exactly what other education points you can add on to that.